There's an important story that I saw just before we get into the politics of the day, and that is on page 7 of the Standard. They're talking about a study links contraceptive use to cancer. They're talking about there's a high risk of leukemia in children born by women taking hormonal contraceptives, according to a new study. And looking at the brief of the statistics, they're saying that 57.4% of women of the reproductive age, that I believe is between 14 and 49, are using birth control methods, and they are saying that 8% of the women who use the 8%, the number of women who use the pill as a form of birth control in Kenya. This is a hormonal pill that controls birth, and then they are saying that 26% is the number of women who use injectables as the form of birth control. So the question here is, this is an important topic because women in this country have that tendency. Looking at this percentage, 57% is quite high. But how do you manage this so that it doesn't lead to unforeseen repercussions that go to affect the health of these women?
Well, I think we must step up our efforts around awareness of some of these issues. You might find that that is a study or that is a report that sits in a journal somewhere that many women, the 57.4% that you've cited, will not be able to access. So we must step up our efforts in creating awareness in public health, in making our women and even men aware of the implications. When we devolve health to county governments. And I know there are a lot of concerns, and there are people who have come up with all sorts of outlandish suggestions that health needs to go back to the national government. I don't think health should ever be reverted to the national government. The right place for health provision is at the county government level. So, for example, if we wanted to do public awareness, as I've said, is necessary, how long will it take the national government to reach that woman in Mandera and to reach that woman in Nyatike and to reach that woman in Makueni? It is best done at the county level, that principle of subsidiarity. Sure. And so we must continue empowering our county governments. We must continue challenging our county governments as well to be able to offer health services, to be able to provide information, and to be able to give our women and parents choice. Cancer is becoming one of the major killers in this country. And unfortunately, we don't have enough centers to deal with cancer. Just last evening, I was in a conversation with the CEC for Health for Kisii County. You know, some of the counties in the Lake region have come together and they've decided that each county shall specialize in something. And so Kisii County has been chosen as the model center for health and particularly for cancer treatment. And we are having a discussion around availability of oncologists and persons who are trained to manage cancer incidences. And there's a huge, huge shortfall. When the doctors came from Cuba, instead of getting an oncologist, Kisii County got a plastic surgeon. Whoa. That was a list of their problems. But they were given a plastic surgeon. And, you know, we remarked that the conversation about Cuban doctors, it was hot at some point. And now nobody even seems to remember that we have doctors from Cuba doing plastic surgery and doing family health, giving contraceptives here, jobs that can be done. What we needed were oncologists. What we needed were serious specialists in fields that we do not have enough personnel and enough skills today. And so that story, in as much as it starts from contraceptives and it leads into the issues of cancer, we must ask ourselves as leaders and as those who sit in the Senate that is supposed to support devolution, how prepared are we to offer these services at our counties? I mean, I was excited when Senator Mutula Kilonzo had an incident in Nandi, and the county hospitals in Nandi were able to respond pretty fast, despite all the drama that was being portrayed in the media. And that kind of response should not be reserved only for the leadership. It should be a response that is available to anybody and everybody who needs those kind of services. And that is why, now that we are going back to the Senate, there'll still be that debate about the 9 billion shillings that was supposed to be given to counties. Personally, I believe that counties should get this money because it is that money that will end up as an investment in the health sector, that will end up as a budget for the publicity and awareness, and that will end up as a budget for establishment of cancer centers and training of oncologists who are going to save our women.
Senator Mutula, the question to you, how much of the actions that are taken by counties, and especially your county, Makueni, is informed by research, so that the decisions that you make for the health sector in Makueni County or any other county is research-driven, so that such kind of incidences can be avoided way in advance before they get to the patients?
In the function of health, the category of research and statistics, particularly, was left with national government, and the budget. The huge budget the national government, particularly the Ministry of Health, has enjoyed for the last several years, is particularly given for purposes of research. Sometimes, and although you have taken it as gospel truth that women are using this, women are doing this, I think sometimes the category of research has not been given the prominence it should. Number two, we do not discuss these things in detail. Most of this medical care or medicines that are used in the country is imported. It is not manufactured here. So up to what extent does national government, and through the Ministry of Health and KEMRI, do research on some of the medicines that we find in our shelves? Sure. Before you have such headlines, splashing headlines about the cancer treatment, etc., etc. So it's a disservice to the women of this country who are walking into our chemists to look for contraceptives, which there are study links contraceptives to cancer. And yet, when you read this, you most likely, because I've not read it, you will not see a contradicting statement from either KEMRI, because every research that you do, every opinion that you do on things like this should have a byline either of the ministry, or the ministry should have issued a research. I'm not quite sure up to what extent the person who wrote this article either spoke to KEMRI or spoke to medical research. As Kajwang puts it, the marrying of the medical function of health at county level, and he's right. By the time I got to Moi Teaching and Referral Hospital, there were 10 experts who were available to attend to me, to say that medical care in this country is available to everybody, including in public hospitals where I was treated. The dispensing of medicine, what we call medical care, or the injection. I remember I had a quarrel with one of the doctors in Kapsabet who injected me, and I said, why do you have to inject me?
You want your tablets.
I mean, why do I need to, undress so that you inject me?
Yeah.
The medical care we are talking about is not the ordinary, I need an injection. There's something we talk about out there in the villages, that when a person is sick at home and they are told, I'm going to inject you, it gives the impression that you are going to heal. Yes.
Faster than tablets.
Faster than tablets. But the research that was done, and you know very well that and malaria is still an issue out there where Senator Kajwang comes from. The research that has gone into diseases like malaria, bilharzia, water-prone diseases, is the sort of thing that ought to be done when it comes to contraceptives. Reproductive health. So that, and remember the bill that was done by Senator Sijeni was plagiarized and was condomized, as they say, and we never got to hear the benefit of the value of medical research. So the emphasis that we should lay, Senator Kajwang and I, is to ask national government to account and to give us reports on how far we are doing in terms of medical research on not only this, many other things that are affecting ordinary Kenyans.
That's right.
And well, Gituko, just to interject on that, we formed a caucus within Parliament, and we call it the Parliamentary Caucus on Evidence-Based Decision-Making. Because there's been a great concern that many a times we make decisions not on the basis of evidence, but on the basis of gut feel. And I think it is that realization that has brought together close to 50 members of Parliament. We caucus, we meet fairly regularly to see ways of making sure that our bills, our motions, and whatever it is we do in Parliament is informed by evidence. Because, as I say, figures don't lie.